In 2018, the University of the Philippines Mindanao, the Davao Medical School Foundation Incorporated, and the local government of Davao City engaged in a research collaboration to understand the problem of rabies in Davao City. 2 years later, our research findings have placed us in a better position to describe this public health issue and make appropriate recommendations. Rabies reports continue to fluctuate in Davao City, and the 2022 Zero Rabies goal of the Philippines is fast approaching. The big question remains, is zero rabies a dream or a reality? How can we help the local government achieve this goal soon? The Stop Rabies team proposes 5 major policy recommendations that can improve our chances of winning against this virus. First, strengthening rabies control programs through mandatory pet registration. Second, securing lives through a mandatory annual pet vaccination. Third, having a transitory impounding center and return to owner systems for impounded pet dogs. Fourth, operationalize a pet breeder registry. And fifth, provision of district-specific animal biotreatment center establishments and referral system. Mandatory pet registration is a basic provision in the National Anti-Rabies Act of 2007. In Davao City, pet registration is currently linked with mass vaccination program in which vaccinated pets are automatically registered. However, records show that rabies cases in Davao City were mostly unvaccinated pets, which means that these were unregistered. Hence, there is a need to engage unregistered pets in the government's rabies program through a strengthened local implementation of the mandatory registration. Mandatory registration can transform the city's rabies control program towards favorable outcomes. First of all, it promotes responsible pet ownership by engaging all pet owners in the city. Furthermore, it will generate a comprehensive and updated record of the pet population, which can be used to optimize and improve government operations. But an owner-friendly and participative platform will be needed to ensure the success and sustainability of this strategy, and this can be achieved through partnerships with the industry, pet organizations, and the academy. On the other hand, vaccination has been the most cost-effective approach in controlling and eradicating rabies. According to the World Health Organization, 70% of the dog population should be vaccinated to achieve herd immunity, or in other words, for the population to gain protection or immunity against rabies. However, according to the CVO data, the vaccine coverage from 2011 to 2017 has not reached the minimum 70% vaccine coverage. Furthermore, dogs are expected to undergo a yearly vaccination as the vaccine-induced immunity against rabies usually lasts only for a year. However, based on a survey, 49% of the pet dogs did not receive vaccines annually, even if the vaccines were for free. Furthermore, we found out that 80% of the annually vaccinated dogs reached the protective titer against rabies. Hence, we suggest a mandatory yearly pet vaccination coupled with a minimum 70% vaccine coverage target so that we can secure the safety of dogs and even humans against rabies. Meanwhile, Davao City has an excellent impounding system which we found to have significantly contributed to rabies control. However, the impounding facility has a limited capacity of 150 dogs. Hence, we suggest a temporary impounding center at the barangay level to speed up the clearing of the street dogs while decongesting the city pound. This will also be a pet-friendly system since the barangay pound will enable immediate retrieval of dogs by their owners within the locality. If the dog is identifiable, a return to owner immediately policy is recommended. Pet adoption of temporarily impounded and unclaimed dogs can also be made possible through this system. Hence, this strategy will make our streets rabies-free and animal bite-free in a pet-friendly manner. Some pet owners are also breeders, either backyard or commercial. Pet breeders are unrecognized players in the rabies arena, and we can engage them in the fight towards achieving a rabies-free Davao City. One of the ways we can do this is by establishing a pet breeder registry. With a pet breeder registry system, we can uphold the welfare of the dogs, specifically puppies that are for sale, by providing freebies, for instance vaccination or free checkups. It will also promote standards to ensure buyers that their new pet is safe and healthy. For instance, we have shown that rabies can spread to distant barangays of Davao City and even other provinces. The trading of pets is identified as some of the human practices that can contribute to this. Operating a breeder registry will therefore help limit the undocumented movement of infected dogs. Now let's move to the human victims of rabies. How can we improve the management of animal bite cases? From 2011 to 2017, animal bite patients' vaccination compliance rate in Davao City was only between 54 and 64%, which can be linked to issues on the accessibility of animal bite treatment centers. This highlights the need to fulfill the recommended number of the ABTCs according to the National Rabies Protection and Control Program guidelines. Thus, we suggest establishing district-specific animal bite treatment centers in Davao City, which is expected to improve the frequency of case reporting and enhance accessibility to vaccination facilities. These district-specific APTCs shall be providing all the necessary services that should be given to a dog bite victim residing in a particular district. For instance, the Kalinan district should have one APTC so that its resident need not to go to the Book district. This will encourage full compliance of bite victims to the recommended vaccination schedules. Such a strategy can potentially eliminate human rabies in Davao City by providing a convenient channel for bite victims to acquire and complete their vaccination regimen. Integrating these proposed top policies into the city's existing rabies program will introduce novel and improved approaches to eliminate the disease. So going back to the crucial question, is zero rabies in Davao City a dream or a reality? It will definitely become a reality if the local government, pet owner community, pet industry, and the academe work together to stop rabies.